We are celebrating the Raising Childcare Fund turning 5, along with many of our grassroots partners from around the country. We thank the Early Childhood Funders Collaborative for hosting this and for hosting our project and taking this leap with us 5 years ago when we were able to launch this project. I'm Rachel Schumacher. I'm the project director. We have a lot of amazing folks here today. We'd love for anyone who's joining as a guest to go ahead and put in the chat your name and where you're from. We have grantee partners from, I think, 7 states, and that's amazing. So we're going to get right to it. So when we planned this webinar, we didn't quite realize how important the eclipse would become to so many people. And so we reorganized this to make sure our grantee partners get a chance to talk first. We always consider ourselves much less interesting than them. And so we will be putting them, we will be trying to get to them as soon as possible. Today, let me see if I can get there we go. So today we're going to welcome you. We're going to give a chance for all of our grantee partners to introduce themselves, and we're going to have breakout rooms where you, the participants, get 20 minutes directly with one of our grantee partner groups. They're all prepped to tell you about how what their reach and influence was in the last year. And we're also simultaneously letting our report out, which is the Reach and Influence Report. We picked that on purpose as a new title besides annual report, because we really felt like we're getting to the point where our partnership with the movement and our grantee partners that you're going to hear from today are influencing the country. And we're excited to talk about that. For those of you who don't know about the Raising Childcare Fund, and this is your first exposure to us, welcome. We hope that you read our report, join us in one way or another, and share it with your networks. We are focused on 3 important goals in our grant making. The first and primary one is lifting the voices of those who are closest to the pain point of the child care system. That's parents, early educators, caregivers, and other allies. We're providing resources to organizing groups like the ones you're going to hear from today to build power, to make it so that when those voices are lifted, people in power listen. And we're trying to support their efforts to expand equity in childcare, both the financial support and access to childcare, as well as affordability for parents. We are fighting to save pay equity, a wonderful measure in DC that is in danger of being zeroed out in the mayor's budget. And so it's an ongoing fight. It's one of the things we've learned. Once you pass something, you have to make sure it gets implemented with equity, and you have to fight to save it. So these are all the grantee partners we have around the country. They are amazing leaders all, and today you will hear from 7 of our partners. And you know how we've done this. We've had a lot of foundation support over the years. Later on we'll flash our funder support. If you are one of our funders, thank you so much. If you are one of the state funders who support this work in states, thank you so much, because it's going to take a lot of different resources and support to make sure we can win this fight. And we consider ourselves a philanthropic partner with the movement. So we appreciate all of the partners who are coming along with us in giving multi-year general ops grants, and extra when we can find it, to the folks on the call. So without further ado, I am going to, we're going to turn it over to our funder, our grantee partners, to be able to introduce themselves and make sure everyone knows the different groups that we have today. Let's go in order of logos. Would someone from 9 to 5 Georgia like to introduce themselves?
Absolutely. Thanks, Rachel. I'm Erin. I am a chapter organizer for 9 to 5 Georgia. I've been working on our childcare campaigns for a couple of years now. I'm based in Savannah, Georgia.
Lanice, would you like to introduce folks from Alabama?
Sure. I'm Lanice Emanuel with the Alabama Institute for Social Justice. I see some folks in the chat that I recognize, Netsie. So she knows our history, and we were formerly known as the Federation of Child Care Centers of Alabama. Joining me today are two of our child care provider leaders. That's a part of our statewide movement, the Alabama Movement for Child Care, Dr. Constance Dow and Keisha Sappho. Constance is from Mobile, Alabama, and Keisha is from the Dothan Enterprise area in Alabama.
Well, our folks from Alliance for Quality Education.
Hello, everyone. Hope this day finds you well. My name is Zakia Shakir Ansari. Ansari, I'm the co-executive director at Alliance for Quality Education. We have been doing educational justice work for a little over almost 25 years now, and childcare can no longer be denied, thanks or not to the pandemic. We have been fighting to ensure that New York State makes childcare a priority, including ensuring pay equity for those amazing early educators that are there. And I am in Valley Stream, New York.
How about Family Forward in Oregon?
Good morning, good afternoon. Hi, I'm Candace Vickers. I am the Executive Director for Family Forward Oregon. And with us today, we have Sharon Bernstein, our Deputy Director of Programming, also one of our founding executive directors. And we have Caitlin Gaffney, our Development Director as well. Happy to see you all.
How about our folks from Olé in New Mexico?
Good afternoon, everyone. Matthew Henderson from the Olé Education Fund. I'm the executive director, and Miles Tokeno, our deputy director, is with us today. And the clouds just parted for a minute, so we got a great view of the eclipse. Definitely an auspicious sign for the Raising Child Care Fund's birthday.
Spaces in Action, our friends from DC.
Hello, everyone. This is Hope Joyner, Spaces in Action, and on the line with us, we also have Michelle Kilpatrick. She's a contractor for us, and we're based out of DC, and we are extremely excited to be here tonight.
Our amazing team from St. Louis. We have three organizations as part of that team. Who's going to introduce?
Hi, everyone. I am Paula with We Power. On the call with us is also Charlie from We Power, Mackenzie Grayson from Gateway Early Childhood Alliance, and then Alicia Lanier from Urban Sprouts. And then a special guest is Parker. He also is one of the children that directly benefit from this work that we're doing through Urban Sprouts.
I mean, I love that. One of the great things about working in early childhood organizing and advocacy and philanthropy is that everyone is happy to see a child on the line, even before the pandemic happened, and we all experienced that together. What we wanted to do is really celebrate that it's been 5 years since we made our first grants. We have amazing partners on the line who have been with us since 2019, who shared their stories, and we also have folks who just joined us in the last year or two who are doing amazing work. We are always looking for more partners. Our journey started in 2019 with just $1.9 million and 5 foundations interested in trying something different, because we were very concerned that although there had been a lot of changes legislatively, nationally, to the child care legislation and regulation, there was not dedicated new funding, and there was a lot of concern that we had just made a lot of changes that were not going to be implemented with equity. And at the same time, we realized that there were a lot of foundation members of the Early Childhood Funders Collaborative who had not actually funded any type of parent or provider organizing. We had a couple exploratory conversations about this, including one featuring Mary Ignatius, who's on the call from California, and was a group that we were aware of. Just say, you know, this is something that's really going to make power and change for childcare, and we need to have more early childhood funder investment in it. So we were able to start that journey back in 2019. We've been raising funds and now have raised over 17 million and are funding in 16 states in the District of Columbia, with 14 foundations supporting us. It's been an amazing journey, but we are not done. If you heard from our partners, this is a long road to get the kind of changes that you may have heard of when you heard about what New Mexico has been able to achieve in terms of a ballot initiative giving early parents an early childhood right to care. So that took 12 years, and we have to be in it for the long haul to both continue to fund our partners and grow so that we can have a partner in every single state and the District of Columbia. That is our long-term goal. So these are funding goals. To reach that, we need an additional 42 by 2028 and additional 85 from now to 2032, where that would be our goal if we could supersize this project and have leaders like you just heard from today in every single state. Our new report is based on our grantees and what they tell us they are doing and learning. So every year we have an interview with them that we record, we write up, and we share together with them and develop a report based on what they told us and really reduce their burden in the process. And then we go through and analyze it and think, what are the things that they're telling us they're doing with the resources we've given them? And it's no surprise that the fundamental thing that our partners are doing is expanding the base of folks who are engaged in the process, working directly with those most impacted. They are also developing parent and provider leadership. New York and Oregon, and I'm sure most of, and DC, I think specifically talked about how they have built an intentional strategy to engage folks who are closest to the pain point of the childcare system and really listen and really give them an opportunity to come together in both joyful and to express their outrage occasions about what's been happening to them in their lives, and really give them the tools and work with them so that they are leading the project, they are leading the actions, they are deciding the priorities to talk to legislators about. Next is building coalitions and campaigns. That's one of our folks on this call said, how are you working with an early childhood coalition in your state? Is there something else? And oftentimes what we found in this is there's a lot of work to bring together folks who are coming at this issue from different angles, and to make sure parent and provider voice are included. And that's what our partners are doing. They are also making sure that parent and provider voices are being heard through media, social media, engaging them in those processes, and also in hearings and meetings with public officials. And last but not least, they're increasing the supply of equitable childcare by securing new state revenue sources or making policy changes that make the program work better for parents and for providers. And some of those examples, I think you heard in breakouts around waiving co-payments, which is an amazing win from California. There's also a lot of states that have moved to paying based on enrollment versus attendance for their provider community. And that makes a huge difference to providers who might otherwise not want to be part of this system. One thing we just spent a lot of time talking about, and I put in the chat, we actually have spent a lot of time, Liliana spent a lot of time talking to partners about how they develop their leadership ladder. And we developed a graphic based on what we heard from them, really going from that initial engagement all the way to super leaders. And this is one of the findings in our report for funders, is that very often we ask as a funder to our grantee partners that they need to report on something that is actually not central to their work, or not what they see as the most meaningful piece of their work, especially if they're doing power building. And one of the ways that happens is not taking into account a way to measure leadership development. And there's some interesting research that we talk about in the paper that several of our grantees were involved in, that it's really talking about what are new ways to use technology and data collection to actually quantify how developing a super leader, this is someone who's, they might come in and just have a story to tell and feel very hopeless and frustrated by that story. But through the process of parent and provider leadership that our grantee partners are using, those folks find other people that have a like story. They start to realize that this is not their fault. It's part of a larger systemic problem, and they get involved in learning the leadership skills and then recruiting other folks, as well as helping lead the charge in the strategy of their partners, so of their campaigns. So that is something that we have a lot, and this is a picture from our folks at 9 to 5, I think. That is something that we really are excited to talk about. But ultimately, one of the things that we are really proud of this year is, you may have heard a lot about the cliff effect, and not the old cliff effect we had when families lose childcare at a certain income level and fall off the cliff, but now the whole country went over a cliff. And that was the end of the funding that the federal government put in place to respond to the pandemic. $24 billion in grants that states used to childcare programs to allow them to provide wage bonuses, health insurance, education supplies for kids, and more, ended September 2023. Now, that budget, there was a lot of effort to try to renew it in the budget process, but as you all know, that didn't even get finalized until I think a couple weeks ago. So we are still going over this cliff. What we are very proud to talk about today is that our grantee partners have been involved in campaigns in 5 of the 11 states that have helped win $2.9 billion in state revenue to push back up the cliff, soften the fall, catch the wage supply, the wage bonuses. I'm not sure exactly what our graphic is telling you, but we did want to try to help folks understand that this is a big deal. And we had groups in every state that were robust and well-funded and able to push back, we might be getting a lot more dollars out of our state budgets than we currently are to help make up the difference in our national situation here, which is that we are losing providers, we are losing early educators who are leaving the system. It's really a challenging time for care.
So yeah, I would just say, like, over the last 10, 15 years in particular, it's been, organizing a base of parents, building community around them, supporting them to identify solutions to what's causing the most harm, and then winning because it works, and it's really, really exciting.
I can jump in. This is Steph from Denver. I really appreciated hearing about the Spaces in Action leadership ladder, and the levels that people go through to get more experience and capacity and comfort as they do their organizing. So I thought that was really super helpful. And one of the questions I asked them on the what do I want to learn more about side is, and I'm curious if anybody else has thoughts, I'm interested in how people share or coordinate across what it takes to do advocacy. So sometimes there's parent organizing, there may be sort of policy development or policy parts of things, there's communications, there's other components, and I'm curious about how people collaborate in order to get as much done as possible while not having to do it all themselves. So I'm just curious about that in the future.
So any of our partners could probably jump in and answer that. Who'd like to take that question?
I can jump in and answer it for Spaces in Action. So one of the big things that we work hard not to do is to work in silos. And so every single campaign that we work on, they overlap. Our child care tax credit, their parents, they need health equity. And so we have we work together every Monday and Tuesday, we're in the office, and then Wednesday, Thursday, and Friday, we have our regular meetings where we come together and we figure out, well, what are you working on that overlaps in this campaign, and how can we pull in our different bases of people so that we don't have that separation? We just have one large base, since everything intertwines with each other. Intersectionality is one of the big things that we talk about when we have our community meetings. It's something that we have been more intentional around working on this year, and it started last year. And so that's one of our, I hope that answered your question, but that's one of our big ways of making sure that we're not working in silos, not carrying the load individually.
Yeah, and I would say we have not mastered this. We talk about it, but we haven't mastered it. Is our coalition work. So in theory, there's a way for, because we're 3 orgs here in St. Louis, for like Urban Sprouts and I would say the Alliance to really be the base to activate providers, because they're already providing capacity building. And then for like We Power and Urban Sprouts to say we're going to activate for We Power to activate parents, and then for Urban Sprouts, because it's a actual childcare center, to activate both parents and providers. So I think the short answer is the work being done in coalition versus it being a single organization can and should allow us to have a broader impact in terms of activating people and building their capacity to organize.
I love that you uplifted coalition work, Charlie, and that's a big part of the work here in Oregon as well. You know, we work with 20 other organizations that span direct service to advocacy work and represent the different culturally specific organizations that are doing the work here in Oregon. And I would also offer that we have an organizational framework that is not triangular or linear. Our organizational framework puts the voices of mothers and caregivers at the center, and that's the decision-making body. Those are the folks who make the decisions on what campaigns we uplift and build, and those are the ones who really dictate how our advocacy work goes. If it doesn't come from the moms and caregivers, then it's not happening, right? So that's something that's really intentional. And I'd love to share our visual for that organizational framework, because it's pretty powerful.
Thank you, Candace. I just wanted to add one thing I've learned here with my group of folks that I work with daily is making sure that those impacted are the ones at the decision table. And so I appreciate my group for teaching me that and instilling that in me as I come to this work. And so being able to learn from folks like Alicia Lanier, who is a provider, but works very hard to connect all the dots is really important as well.
And this is Lanice. I'd like to sort of build off of one thing Mackenzie just said, is making sure that we get the people to the table. You know, that's something I've always believed in. It's a sword that I'm always willing to die on, because I think that it is just sort of counterintuitive and quite honestly a little, disrespectful to actually be making policies and making decisions and not have the people that's most impacted at the table. For sure, that's one thing that we've done. But I also want to talk about how the Raising Childcare Fund allowed us the flexibility to actually reinvest in the base. And that was just sort of genius to me, because these folks are dedicating hours and hours and hours of their personal time to the movement. And so when you're actually able to invest in them, they doubled our base like in a matter of 5 months, because we paid them so much money over 5 months, and then they have all these relationships in place. They were setting up at childcare conferences, and we did all the things right to make sure they had the paraphernalia in a brochure, et cetera. But we have to make sure the people most impacted are at the table for sure. But we also have to consider investing in the people who are most impacted by this work in order to build the base. That is sort of like the gift that I actually keep on giving, because you have to keep in mind that these are business owners and leaders, and they are also operating from places of deprivation personally and in terms of their business. So I think, and some of them are actually on this call now, they would say that that was a big help, and it's certainly a strategy that we know that works.
Can I, real quick, I know, I'm sorry. The one thing I want to add, I said, like, kudos to all the things that we also work in coalition for many years. Like, it's really important. One of the things that I brought up that we do, which I think couples and couch is really nice with all these things, because impacted folks are vital. They're 100% what we need. And also their understanding of how politics works is very important too. So we have created an early education warrior program. And I didn't mention the other group, but this is the first year we've been able to provide a stipend for folks. They are providers and some parents as well who are part of this. And so they go through trainings. It's an 8 to 10 month leadership development training. So they learn everything to how to conduct a one-on-one, to understanding the state politics as well as local politics and how that works, to institutional and structural racism, because all that impacts. As we opened up this conversation, we know how that impacts. To talk, the most recent one that they'll be up against this month coming up is around social media and how do you manipulate that, right? Legislators are on social media. Many of our providers are not, because they're busy doing other work. But what's the importance of that? It's not the organizing, but it is a tool that we can use to actually get our point, to fund us, to pay us equitably, to legislators who are there because they think that's the place to be. So if they want to be there, we're going to show up as providers and parents and show up in those spaces, those social media spaces. And to be able to provide a stipend for them is just a little bit helpful, right? To be in the pocket, but also to show up on a long day that they've had, that our trainees are from 6 to 8:30 and they stay on until the end, right? Because they're getting something from it, because the passion and what they already have is instilled in them because they're doing the work. But now we have coupled and couched in them understanding how the politics works, but also to be able to answer any questions they have. And now they have tools and techniques they can use to organize parents in their centers and or other providers, et cetera. But I just wanted to co-sign coalition work is vitally important. And those leadership development skills allow them to take their A game up to A+.
You started answering the question because my next question was, how do you mobilize the providers and the parents to show up at stuff when they're already overtaxed? What's the spark that gets them to the table consistently? So sort of two questions there.
Hey, thank you so much. So yes, Urban Sprouts is an early childhood organization. I am an early childhood provider. We care for 145 children each day. But we realized that in order to really get things done, that we need to be investing in the system. And what I saw after many years is that there weren't many providers at the table. So we've built our coalition over time. And we've incentivized it with gift cards, food, childcare, everything that we can. We Power and the Alliance, they share the cost of childcare and they share the cost of food. So those are all two things that people really appreciate having at our meetings. And I think it's a tell a friend, tell a friend. Once you start getting people frustrated and riled up about the system, it's they just keep joining. And so we may not have a lot of people join all at once, but when the state takes an adverse action against us, we get many of the providers get frustrated, and so then they get involved. We also use group chats. Our group chat is really a way to get people involved, and we offer lots of virtual options where they don't have to come in for a physical meeting. So you have those who kind of want to be sort of onlookers and participate through just hey, I want to use my voice by signing a petition. And then you have those who actually want to do some of the work or go up to to Jeff City. So it just depends.
Yeah, and then I would build on that to respond to your question, Lisa. The Gateway Early Childhood Alliance, led by McKinsey, is the early childhood organization. So they were formed to do the regional work across the St. Louis area to basically bring all of us together, to bring Urban Sprouts together, to bring We Power together, to bring all the other stakeholders together. So we work towards a shared vision and a shared set of strategies. So that's like the home that organizes all of us. And so We Power, the role we play is we are like the power building, organizing, policy partner that works with the Alliance. And then like Urban Sprouts is the childcare center that is really lifting provider voice and making sure that whatever happens, whether it's policy or capacity building or funding, is truly responsive to what childcare providers need.
I appreciate that, Charlie, and I just want to add, we work to like fight against that myth of like this being in the way for them and to provide it as a resource. And what we have heard from our provider group of more than 50 providers here in Oregon is that this can be really isolating work. And the opportunity for them to come together in fellowship and to make their voice a collective voice as they work toward policies that are going to help them impact, right? Like the lives of the families that they serve, but also their working environments and what they have access to as providers is super important. And that they tell us like that opportunity to fellowship is super important. And most recently, that group has come together and made a decision collectively that they want to participate in a day without childcare. And what we do is we provide the resources, we provide all of the materials, we provide all of the training spaces, we rent out the park to make sure that they can have a space for their families to go that's safe, right? Like we provide all of those pieces so that they can engage in the actions that make them most excited, as opposed to, right, like the other way that could look, where we go to them and we do an ask, right? The ask that we have is, what do you need? What do you want? And how can we help facilitate you in making that happen? And that's the thing that makes them not see this, I don't think, as a burden. What we keep hearing is, thank you so much for the opportunity to fellowship. I think the one other thing that I'll add is we have to work really hard to stay in relationship with the systems that they're engaged with. So for example, we work with the R&R, right? Like the organization that they have to go to for professional development to continue their licensure, to make sure that we're bringing them into that space and providing them access to the things that they need to stay in business, right? And then providing them access to information around capacity grants and helping them grow, right? So yeah, I think the fellowship piece for them has been really important. And I don't want to speak for providers, but those are the voices I'm charged to uplift, and they want to be able to come together to decrease that isolation. Absolutely.
Thank you. We are cognizant that although we had originally thought this would go until another half hour, some people might be dropping off to go look at an eclipse. So we wanted to make sure we gave our grantee partners a chance to close out this hour. And then if you are able to remain on, we will be talking more about the reach and influence report and recording it. But if in the last few minutes before folks might need to go on the hour, would any of our grantee partners want to share anything in particular that they would like our foundation partners who are on the call to hear about what it's like to fundraise, what kind of help or support or companionship they could use? Anything else like that you would like to share?
I am going to jump in real quick, Rachel, because this was a piece I think that we referenced as we were sharing in our small group. We know that right now there's a myth of competing priorities, whether it's risk of houselessness, behavioral health, addiction services, and we are working really hard to erase that myth, that it is a myth, that childcare work, access to care for all communities is work that increases economic security, increases the safety of families, families increases the likelihood for them to stay unified. And if we can just impress upon those folks who are looking for us to articulate that work, to not separate the issues, that this work is directly tied to the health of our communities and includes all of those other intersectional impacts. That's one thing that's super important for us, yes. If you fund care work, you're funding houselessness work, you're funding addiction work, you're funding, right, economic security work all around, yes.
Yeah, I would add and build on what Candace said. The funding piece is so critical, and we need power building, advocacy, electoral funding, just as much as programmatic funding. And we are super, super grateful to have a funder like RCCF. We have close to no funding for this work. We are being creative, honestly, and using money from other, because we have a whole like economic power building team. But I don't know how we're gonna, I literally don't know how we're gonna pay the bills after a few months, because we have close to no local partners that are funding advocacy and power building. They only want to fund direct service and programmatic work, which is good, but they're gonna be hamster wheels. They're never going to see the impact of their money unless they also fund advocacy work. So I think it would be great for funders to earmark a certain % of their annual budget to say we are going to consistently invest in organizing advocacy so that their direct service money actually means something versus it being a Band-Aid.
Well, judging from the comments, a lot of the folks on the call agree with you and are really glad you both voiced those opinions. And we want to thank all of our national pool funders, some of whom were on the line today, for their support. Thank you so much for being on this journey with us. And the number of state funders wouldn't even fit on this slide, so we probably need to work on figuring out how to acknowledge them. But thank you very much for being here today.